Hi, I'm Nurse Barb, and this is your daily dose on women's health and fibroids. Many women have been told that they have fibroids, and they have a lot of questions about what they are, why they happen, and what they need to do about them. Well, fibroids are super common. In fact, 1/3, that means about 33% of women over 30 will be found to have a fibroid, and most of the time it doesn't cause any issues. About 1/2 of women over 50 also have fibroids, and this number is much higher in Black women and women of color. We really don't know why fibroids occur, but we do know that they're pretty normal. Fibroids are typically 99.5% of the time, they are benign. That means they're not cancerous and they're not abnormal. And if they're not causing any problems for you, you don't have to treat them. But during an exam, your provider might say, wow, your uterus feels a little irregular in shape. I'd like to get an ultrasound to see what's going on. Or you may be having some irregular bleeding or a lot of pain or a lot of pressure. And again, your provider may order an ultrasound, which is how we typically diagnose fibroids. So I've got a uterine model here so I can show you what they look like. So first we're going to start with a normal uterus that doesn't have any fibroids, and then I'll show you what the fibroids look like. So this uterine model here shows you the whole uterus and the vagina. It also shows you the tubes and the ovaries. And this is cool because I can take it apart. It's held together by magnets. So this shows you the inside of the uterus. So here, what you see is the tubes. The top of the uterus is here, and here's the lining. And this is the muscle of the uterus. Again, the cervix and the vagina. So in this situation, there are no fibroids to be seen. Now, in this situation, what you see is a lot of different pathology that can occur, but for now, we're just gonna concentrate on the fibroids. Let me bring this in a little bit for you. So here you see the tubes, here you see the top of the uterus, and you see a lot of issues going on here with this tube. Up here is what we're going to concentrate on today. These are the fibroids. These are these small, typically calcifications that can grow inside the muscle of the uterus. They can also grow on the outside on a stalk. It kind of looks like a mushroom. Or a fibroid can be on the lining of the uterus, causing a lot of bleeding. And so this is something that I see in my perimenopausal and menopausal patients where fibroids cause a lot of bleeding and a lot of pain. Now, fibroids can get much, much larger. In fact, we've seen patients who have fibroids that are as big as a lemon or a grapefruit. I even had one patient whose fibroid grew big enough to be about the size of a cantaloupe. Now, that occupies a lot of space, they're quite heavy, and they can cause a lot of symptoms. So they can press on the bladder, they can press on the intestines, causing a lot of difficulty with bowel movements. And when they're pressing on the bladder, women often feel a sense of urgency or that they have to go often. Many women who have fibroids that are inside the lining of the uterus will have heavy, heavy bleeding. And of course, if a woman has fibroids and she's pregnant, those fibroids can cause a lot of discomfort and a lot of cramping. And if they're close to the vaginal opening or close to the cervix, a fibroid, imagine a fibroid right here and a baby trying to get out, that can block that area. So what do we do if a woman has fibroids? Well, as I say to my patients, if it ain't broke, don't fix it. So if there's no problem, we can just monitor. During the annual physical exam, we do a pelvic exam and see if that uterus has gotten any larger. Oftentimes, I might order an ultrasound every 6 to 12 months to monitor the size or growth of a fibroid. I had one patient who had ultrasounds every year, and when her fibroids became so uncomfortable and caused a lot of pressure and pain, she decided to have them removed. There's many different options to treat fibroids, and no two women are alike, and one size never fits all. So if you've been told that you have a fibroid, I want to reassure you, the first thing is you don't necessarily have to have surgery. There are new medications that are available that can help treat them, and many women can have what's called minimally invasive procedures to help shrink those fibroids so they can preserve their uterus and not have to have it removed or have a hysterectomy. When it comes to fibroid management, one of the most important things to remember is these can absolutely cause a lot of pain and discomfort, especially if you're still having a period. Because when you're having a period, what happens is the uterine muscle here is contracting to get rid of the blood, right? So you have contractions and relaxation, and those contractions on the muscle, that can cause a lot of discomfort. So if you have fibroids and you have a lot of pain, that's something to talk to your healthcare provider about, because there are medications that are not addictive, that don't have any opioids in them, that you might find really beneficial to help with your fibroid pain. I hope that this has been helpful for you, and if so, please click on the like button and subscribe to my videos. Take care and be well.